Today we're going to be talking about bringing your own devices in healthcare. David Devine wrote a great article called Bring Your Own Device Reality and What to Do About It. To set up the talk today, let's read the first couple paragraphs of his article. Every day, an oncology nurse at a busy academic medical center responds to dozens of emails and phone calls concerning medication refills, patient diagnosis, and pathologies. If her phone line is busy, physicians send standard text messages to her personal cell phone. Her phone lacks geofencing or other security technology, and she receives text messages with patient-protected health information through the hospital's visitor Wi-Fi because the hospital does not yet let nurses have access to a secured network. After work, the texts and emails continue, and the veteran cancer nurse uses the free Wi-Fi at Starbucks and her home network to respond. She hasn't been given clear instruction on the use of email or text messaging over her cell phone, so she continues with it. All she knows is this: if she waits until morning to respond to texts and emails, she won't be able to keep up with her next day's workload, and patient care will be compromised. Bring your own device. Is it worth the risk to implement? Is it worth the risk not to? As the CIO of a healthcare organization, you need to consider the following. Employees are more mobile today. Most employees have their own personal devices already. Could there be productivity gains if employees use their own devices? Could there be a cost savings to the organization? What is the potential risk as well as the solutions to lost devices? And are employees using their own devices today without any security protocols? In the past, if you were to ask to bring your own device in a healthcare setting, the answer is just going to be a flat-out no. Today, it's not so simple. In 2017, there was a survey done, and then shows there's 10 things you should know about bringing your own devices in 2017. According to the survey, 71% of respondents say some form of bringing your own device is allowed at their hospital. The number one concern is data security. And personal devices for work, they use them whether or not they're allowed or not. 63% of physicians use them, 41% of nurses. So nurses are going to prefer a hospital-issued device 59% of the time. Physicians, only 38% of the time. There's going to be some challenges with bringing your own devices. Wi-Fi infrastructure, data security, as well as the infrastructure. The role of the person is going to vary of who would prefer bringing your own device or not. Or not just prefer, but also use bringing your own devices. Is there a cost savings? Well, according to this, the 58% of budgets will increase or stay flat. And you might think, well, surely there must be some sort of cost savings. Well, let's do the math and figure it out. So if you have to buy your employees a cell phone, it's going to cost a monthly charge, $27 a month for a top iPhone or Samsung phone. Also, from a monthly minutes usage, text messaging, data, probably going to cost you $30 a month if you can get a really good deal for a lot of employees. Let's call it $57 per month per user. Let's say you have 200 employees in your organization. Well, that's going to be $11,400 monthly or $136,000 annually. Is that something that you are already spending from a mobile phone or a hard phone in your hospital for your employees? If you're not spending that annually and you're spending something more than that, switching to cell phones might be a good idea. If not, maybe you should consider what those costs would be. So, security, mobile device management. If you're going to have any sort of bring your own device, and if you're issuing cell phones to your employees, you need mobile device management. You need to be able to remote configure those devices. You need to have software tracking, application security. You really need to have the ability to remote lock or wipe those devices. That laptop gets left in the back seat pocket of a plane. What's going to happen when you can't find that device? Data usage tracking, end-to-end encryption, password management, disabling apps, and jailbreak detection. Those are definitely things that mobile device management software needs to have. You also have to consider the employee experience. Will employees want to bring their own devices with the security requirements that they will have to agree to? So if I bring my own device into work, do I want work to be able to remote wipe that machine? It's my own personal device. What if I lose it? I'm not only losing my work stuff, I'm also losing the pictures of my kids. I'm also giving up some privacy on my search history and how I use my phone. Is that something that I want to allow my employer to have access to? And how, as a CIO, are you going to navigate those waters? Some take-home points today: bringing your own device could definitely be a possibility today in your organization. It's not just a flat-out no. However, mobile device management security needs to be put into place, regardless if you have a bring your own device or not. Here's the references for the articles I've referenced today. Thank you so much for listening.